Welcome to St. Barnabas and to the beautiful Kean Theater. We are so glad you could be here with us tonight. I'm Ray Carter. I'm the Vice President and General Manager of WPXI Television. We are longtime partners of St. Barnabas. We have done many initiatives and projects and events with St. Barnabas. Two critical and key ones have been Presence for Patients for about 3 decades. The St. Barnabas CEO Leadership Conference we have been involved with almost from the beginning. I believe, except for 1 year, we've been involved with the CEO Leadership Conference. St. Barnabas has been a wonderful partner of ours, and we appreciate the confidence that they've shown in us, and we appreciate the contributions they make to this community. They are remarkable people. But we're not here for Presence for Patients. We are not here for the CEO Leadership Conference. We are here to talk tonight about an important topic, a topic that is getting a lot of play in the media these days and even movies made about it. Concussions have been getting a lot of attention. Doctors know now that brain trauma, even seemingly minor concussions, can have lasting consequences days, weeks, and even decades after the original incident. You can't tell by my stature or by my weight, but at one time I played college rugby. This was well over 30 years ago, and the position that I played was called a fullback. And the fullback is, on the defensive end, the last man to stop an opponent from scoring. And on the offensive side of the ball, if you break through the line, usually the person that gets to score. And I love the sport of rugby. It is fast, but it is also terribly violent. And I remember when my parents saw my very first college rugby game. We were at the University of San Diego, a small Catholic school with a very good rugby team. And I knew if I broke through that line, I could show my parents something, and I could alleviate my mother's concerns about the lunacy of playing rugby while in college and the dangers of it. And I broke through the line, and I'm running up the sidelines, and I can see the goal line ahead of me, and I think, this is how I convince my mother that I've made a great decision to play college rugby. And I am running with everything I've got. And all I see is a clear field. Nobody between me and the goal line. But I had a blind spot. And there was a very large, very fast Polynesian fellow who was intent on not letting me score. And I didn't know he was cutting off the angle of that field. And just as I thought I was going to cross the goal line, he gave me a forearm shiver like this. And just like in the cartoons, when the head and the shoulders stop and the feet keep going, that is what it looked like. And I went up in the air, and I came back down flat, and my head hit that very hard turf, and I was knocked out. This was the very first game my parents had ever seen me play in college. It was the very last game my mother ever saw me play in college. My dad thought it was funny, so he thought he'd come back and watch it for entertainment value. I was concussed, and I tell you this story, not for the revelry of the story, but I tell you to put in context how far we have come. That was on a Friday, that game, and on Monday, I was back at practice. The following Friday, I played in a college rugby game. I had no business being on that field. Thank heavens, we as a society understand the dangers. Thank heavens we understand that we need to treat this differently. There was certainly a time when we thought that hitting your head was no different than hitting your arm or another part of your body. How wrong we were. Coaches used to say, shake it off, get up. Be a man, get back in there. Thank heavens we no longer do that. Now we sit kids until they can be cleared by a physician, which is appropriate. Concussions don't just affect the world of sports, and they certainly don't just affect younger people. The brain trauma at any age can have serious consequences, including early dementia and a greater risk of Alzheimer's. Here tonight, to help us sort out the differences between fact and fiction, is a name that you will be familiar with. He is a renowned neurosurgeon, an expert in sports medicine. He has been one of the physicians of the Pittsburgh Steelers for many, many years. He has written books on nutrition and aging, and in January of 2015, he began what I think is a marvelous partnership with St. Barnabas when he joined them as a senior medical consultant to develop the Cognitive Brain Health Program here at St. Barnabas. He is a man who also practices what he preaches. He speaks of health and he lives it. He has run 70 triathlons. 70. 8 of those have been Ironman triathlons. I can't imagine the pain this man has gone through, all in the name of good health. I cry when the cable TV goes out. I can't imagine running 70 triathlons. This is a man I admire. I admire his intellect. I admire his achievements. And most of all, I admire the good that he has brought to medical practice, good common sense, and educating before the issues ever arise. Ladies and gentlemen, may I call to the podium and introduce Dr. Joseph Maroon.
Thank you so very much, Ray. I appreciate your comments. And he mentioned 70 triathlons, and that's an event where you swim and then you bike and then you run. And I was as tall as Jeff Boast when I started that. I was 6'6" and 250 pounds. And this is what happens when you do too many triathlons. But I want to, like Ray, I want to commend Mr. Day, Karen DeBacke, and the incredible group here at St. Barnabas, because we're very familiar with concussions and brain problems in athletes and in sports. But really, what's the most common injury in the senior population that occurs? It's falls. And what are the consequences of falls? The consequences are broken hips and also broken heads, broken skulls, concussions. And what are the consequences of concussions? As he said, you can have loss of memory, personality change. You can have a whole host of symptoms that we're going to discuss in some detail. And I've had personal experiences like Ray did, and I played college football, and I had many concussions, and so I know what it is. And then I started working with the Steelers in the late 80s, early 90s. And when I first started working with them, if an athlete had a concussion, Franco Harris or Lynn Swan or one of these guys, it was like he recounted, how many fingers do you see? 1 or 2. I'll give you 2 choices. And a little ammonium chloride, smelling salts, and you're back in the game. Today, that becomes a very major medical malpractice incident. In fact, there's students at Duke University now and all across suing the NCAA because of, in quotes, mismanagement of concussions. Well, it's like the philosopher once said, you can never put your foot into the same river twice. It keeps changing. And from the 80s to the 90s to the early 2000s and now, there's been a huge change in what concussions are, how they're managed, and what's the best way to handle them. So it continues to move. And people pick a time and say, you should have known this then. It's not quite that simple. So what I'm going to do is share with you today. I'm going to share with you just kind of we have a very mixed audience. We have some young athletes. We have some older people. And what is a TBI, traumatic brain injury? What is a concussion? And what's the consequences? And more importantly, when you have somebody in St. Barnabas or any facility that has dementia, the first question you ask generally is, what? Is this going to happen to me? Am I going to be here in 10 years or in 15 years in an Alzheimer's facility or needing total care? And the second question is, well, is there anything that I can do to obviate that, to maybe prevent it, or to preserve brain function? And we're going to touch on some things along those lines as well. And so I've been very blessed in my career for many years to be involved with the neuroanatomy, the neurochemistry, the neurophysiology of the brain, which weighs about 2.5 to 3 pounds, maybe a big grapefruit. The consistency of Jell-O or custard. It has no pain fibers, so you can cut through it and you feel nothing. You have over 100 billion nerve cells, 100 billion neurons or nerve cells, and each of these have a synaptic connection where they connect up to 5,000. One cell can connect up to 5,000 other cells, which is just unbelievable virtually. And 20% of the food that we eat that's generated into energy goes to support the brain, which weighs 2.5 pounds versus a 170-pound, 200-pound man or woman. And most of it is fat. So when somebody calls you a fathead, you could say, yeah, that's true. That's true. And so what is a traumatic brain injury? And we know that it occurs when there's a sudden perturbation, trauma to the brain. There's different classifications, mild, moderate, or severe, depending on various factors, whether there's loss of consciousness. But it's important to realize, well, this is what we see in our soldiers and our athletes. So this is what we mean by traumatic brain injury. Any number of reasons and mechanisms. The most common, though, is falls. Falls on the playground, falls from a bike, falls from a scooter, falls in a nursing home. And what happens in a concussion? There are two things. First of all, there's the initial impact. It's called a coup injury, where it means to strike or a blow, and then a contra coup injury. If I fall down on my back and I hit the back of my head, the point where I strike is the initial trauma, but there's a vacuum. My brain is like jelly in a bowl, and it goes posteriorly, and literally there's a vacuum that forms in the front where there's a tearing of blood vessels, the so-called contra coup injury. But suffice it to say that 40% of concussions are caused by falls, which is particularly germane to this particular audience. And on playgrounds, on bicycles, scooters, other wheel devices, those scooters are the most dangerous things next to ATVs. The kids fall, break their bones, hit their heads, and we see in terms of non-fatal playground-related traumatic brain injuries, 20,000 kids a year, emergency visits, monkey bars, all sorts of things, swings. Cheerleading is one of the most dangerous sports there are. If we talk about football, there are many more concussions and broken necks from cheerleading than there is from football. And they're costly. 2.5 million seniors treated in the emergency department for falls each year. And the great majority have usually a hip fracture or a head injury. And the direct medical costs are in the multi-billions of dollars. So with sports concussions, we're going to go between sports and falls and the mechanism of injury. Football and wrestling are the most common. Soccer, the National Soccer Association just outlawed hits to the head, heading the ball, for kids under 12 years of age or so. and 78% of concussions occur during games. So if you look at the top 7 reasons for concussions in kids, ATVs in West Virginia is the most common cause of broken necks and paralysis, ATVs. And baseball, playground, and football, as you can see, 7%. And in this graph from the NCAA, we're talking about wrestling as the #1 cause of concussions, and girls soccer, lacrosse, and ice hockey is actually more so than football. When you all watched the Stanley Cup probably within the last few weeks, it's just amazing to me the speed that's generated on the ice and how they're crashed up against the ice and the hits that are taken there. So that, what's the most important thing when you have a concussion? The most important thing is to rule out a hemorrhage within the brain or within the skull. You can develop a blood clot called the subdural hematoma, or an epidural hematoma, or a subarachnoid hemorrhage. All these things result in trauma to the brain, subsequent enlargement, and also can lead to death. So we want to prevent a second impact syndrome. The brain, once in sports, and this is any of the moms here with kids, if an individual has a concussion and they go back too soon to play and they get hit again, the brain loses what's called autoregulation in terms of the blood flow to the brain, so that your blood pressure goes up and down contingent on the level of your blood pressure. Usually, if you get up and from a sitting position and stand up quickly, your blood vessels constrict to prevent blood from leaving your brain and becoming unconscious or fainting. With a trauma to the brain, you lose that automatic regulation, and you can get massive perfusion, too much blood in the brain, and you literally develop what's called malignant edema, malignant swelling, and it can be fatal. So we want to prevent that. So what's the state-of-the-art assessment? And what's the role of pre-existing factors? And does concussion treatment vary? So the symptoms to look for after a concussion are in the physical, the emotional, and then also in sleep. So the most common thing is foggy. I just feel foggy, I'm not sharp, I'm not myself, I don't feel like I did, I can't concentrate, my balance is off, I have a difficult time remembering new things, new information. And there can be emotional lability. Somebody who was very stable before now is very emotional, they're tearful, they're depressed, they're sad, they're nervous, they have anxiety that they simply can't explain. I don't know what's going on with me, but this is what happens. Sleeping more, sleeping less, and sleep disturbances. The important thing is you don't have to have a loss of consciousness to have a concussion. And this is something for many years you thought, unless I'm knocked out, I lost consciousness, I don't have a concussion. 90% of concussions occur without loss of consciousness, without being knocked out, so to speak. So what do you look for after a concussion? And you look for, in the visual and the balance systems, difficulty focusing, dizziness. I move my head quickly and I get dizzy and off balance, and unable to stand up and heel to toe and stand with my feet together with my arms out. And then it's a so-called neurocognitive testing, the ability to process information. We want to know what on the sidelines, we want to know what your memory is like, your orientation, your ability to process information. And we designed a test called IMPACT. Anybody in here familiar with the IMPACT test? A few. You're going to hear a lot about the IMPACT test, not a lot, but you're going to hear from Jeff, who's going to give you a little opportunity to take the IMPACT test. And basically, Coach Chuck Noll, during his last season with the Steelers, had a quarterback, Bubby Brister, who had a concussion. And I told him that he couldn't play next week against the Dallas Cowboys. And he said, why not? I said, because he's had a concussion, and the guidelines say you have to stay out a minimum of 2 weeks. Well, he looks good to me. He can throw. He knows his plays. He can run. Who wrote the guidelines? Well, I was on the committee. What data did you have? What evidence-based data did you have to say 2 weeks and not 9 days or 6 days? And he said, look, Maroon, if you want me to keep somebody out of football, I want objective data, not specious guidelines that are made up by a committee. Well, he was right. So I went to Mark Lovell, a neuropsychologist at that time at Allegheny General, and we came up with a test called Immediate Post-Athletic Cognitive Testing, IMPACT. And we can evaluate reaction time to 1/100th of a second, the ability to process information, multitasking, and visual and verbal memory. How much can you remember, how quickly, how fast can you do certain tasks? This now, we have now done over 20 million tests because of that question of Coach Chuck Knowles saying, I want objective data. And we now have, since that time, we use it in the Army, the Navy, the Special Forces, hockey, boxing, and everything you see here. So these are the modalities that we look at when somebody has a concussion. The vestibular, which is where you are in space, your balance. The ocular, many people will have ocular problems with concussions, and the ability to think and analyze information. Migraine headaches are fairly common. Anxiety, as I mentioned, and neck pain. Pre-existing factors can lead to worse post-concussion symptoms. Pre-existing things like ADHD, migraine headaches. Young girls are more prone to longer-lasting concussion symptoms than guys, and those who have had motion sensitivity before. So what are the consequences of concussion? We mentioned some of them, and we'll discuss them a little briefly. So what's the post-concussion syndrome is a constellation of symptoms and signs that occur following a concussion, not complicated. And these involve everything that I mentioned before: headache, fatigue, inability, irritability, sensitivity to noise or light, deficits in short-term memory. That is the characteristic of a post-concussion syndrome. What is post-traumatic stress? Post-traumatic stress has many of the same symptoms, but they have flashbacks. I had a young soldier in my office just this past week. He was in Afghanistan. He came in wearing sunglasses, quite disheveled, very, very fidgety, quite nervous, and complaining of terrible headaches and almost total body pain. I hurt in my neck, I hurt in my back, I hurt in my legs. And he'd been on 6 different drugs, psychological drugs to monitor, and antidepressant. He took 1 pill to go to sleep, another pill to wake up, and 2 in the afternoon as an antidepressant, literally. He was on 6 different drugs. And I asked him, I said, do you have flashbacks? And he said, yes, I do. And I said, could you share with me what the flashback is? And he said, when I was in Afghanistan, I was on the rooftop. I don't know if many of you saw American Sniper, the movie, but he was on a rooftop, and he told his buddy, you go to that corner and I'll go over here. And we're going to survey the landscape. And about that time, a sniper on the other side shot him right through the head. And he saw this. And, it got so imprinted in his brain that he's a mental cripple since then because of this feelings of guilt, feelings of responsibility, and the horrible experience it was. And he has these flashbacks every day, and nothing can erase it from the brain. And there's a reason for that as well. But these are the kinds of symptoms you have. The incidence of PTSD, post-traumatic stress disorder, in the military ranges from 12 to 20%. Congressman Tim Murphy here in this area is just pushing through a mental health bill to address some of these issues in the VA and also in other healthcare facilities that I really applaud him. He's been working on this for 3 to 4 years with incredible resistance. It's hard to understand, but anyway, it's a common problem, and these are the way they overlap. So PTSD and MTBI, traumatic brain injury, we feel is part of the same spectrum of brain problems. So what happens in a concussion? And I won't get into this too technically, but let me just say that if you envision this slide here, this is a synapse, one synapse out of the trillion in your brain, where all the chemicals get transmitted and across this junction. And when there's a trauma to the brain, there's a derangement at the synaptic junctions, and there's an in and out flow of potassium and calcium and sodium that immediately results in a short circuit in the brain, if you would. The short circuit causes a massive electrical discharge, and you lose consciousness or have difficulty with all of the things I'm talking about. And look at this from this past year. You remember this hit, perhaps. Watch what happens. Antonio Brown, bam. And he goes down. Look, it's like a rag doll, his head. Watch. Watch this. Bam. He tries to literally take his head off. He's immediately stunned, falls, and in that milliseconds of hit, it completely short-circuited his brain function. So that he was on the field, and our first concern was not only that he hurt his brain, but what happened to his spinal cord. Was he paralyzed? Was he quadriplegic? Which occurs from an injury of this same kind. So what happened was, I mentioned the glucose, the calcium, and this major electrical discharge, the inflow and outflow. It happens in a millisecond, split second, literally. And there's also an inflammatory process that occurs. So if you get a splinter under your finger, what happens to your finger? It hurts. It's pain, dolor. What else happens to it? It swells up, and there's pain, swelling, and hot. It becomes red hot. Why? What happens in the body to make it get red hot, tender, and swollen? Well, pardon me? Exactly. So our bodies have evolved over the courses of millions of years with an immune system called the innate immune system. And with the innate immune system, when your body gets traumatized, your brain or your finger or whatever, blood rushes to that area and releases chemical agents called cytokines, chemokines, and a whole lot of other things. It causes this inflammatory response. Inflammation is the body's attempt to heal itself. If you have a concussion, it's the same response of the immune system, and after 5 to 7 days, 10 days, the body heals, and the microglia go away, and you get better. But what happens if you go back like Ray did in rugby, 3-5 days after a concussion? Then his brain is literally primed for a second injury. So it takes less force to cause a major problem. Before the healing occurs, you then release more microglia, and then it's like a brush fire in a dry forest. It gets turned on, and when it gets turned on, you get what's called a tauopathy. A tau is a protein that forms the structural stability in every nerve, in every axon. It degenerates, and you get chronic traumatic encephalopathy. Mike Webster, Junior Sal, Terry Long, Waters, all the guys that have been reported and talked about. So what Jeff and I have come up with this slide in terms of a progression of the immunological, of the body's innate system, and the excitotoxic aspect of brain injuries, from a MTBI to post-concussion, PTSD, to very severe chronic traumatic encephalopathy. Kind of sophisticated stuff in a way, but I think you get the message. So I think everybody in here has probably heard of Mike Webster, have seen him play, have cheered for him, have observed and proud of him for his Super Bowl rings, his 10 years or so of all-pro status, one of the best centers in the history of the sport, one of the greatest football players for the Pittsburgh Steelers. And when he died, destitute, living out of the back of his pickup truck, confused, disoriented, on various types of drugs, using a taser to shock himself, to wake up in the morning, and to help him go to sleep at night. Benamalu, the forensic pathologist working with Cyril Wecht at the time, managed to get a hold of Mike Webster's brain and thought, this isn't normal behavior at a man his age, 52, I think, or so. And he studied the brain, he cut it and sliced it and did special stains, and he saw that there was this tau deposition in the brain, this degenerative protein that was much more prevalent than it should be. And he wrote this paper in 2005, and he called it Chronic Traumatic Encephalopathy in a National Football League paper, in a player. And this caused a literal firestorm in sports, and the question, how common is this? What are the consequences? Are Ray and I both going to get this because we've had concussions? Are your kids going to have this because they've had a concussion or two? What's the significance of it? What's the prevalence of it? How important is it? And so since then, if you can't pick up a newspaper, turn on the TV on a daily basis without seeing some mention of an athlete who quit football because of the fear of this, an athlete who has it and committed suicide, and all of the consequences. And so Jeff and I asked, you hear this, you think it's epidemic. So how many people who have played football have this now? Am I next? Who's going to have this next? So we reviewed all of the cases of chronic traumatic encephalopathy from 1954 to 2013, thinking there's going to be thousands and thousands of these cases. We found 262 confirmed cases of CTE. 262, okay? It's terrible, but certainly doesn't sound like an epidemic. 43% of these cases were doubly reported and counted twice. So we ended up with a total of 153 reported cases. Of those, 69 were in boxers and 63 in football. And the term pugilistica dementia, or punch-drunk syndrome, something that one of our recent heroes, Muhammad Ali, recently died. I don't, did he leave his brain to be examined? I was asked that, and I don't know. I don't think so. But he had Parkinson's disease, and the question is, were the traumatic blows he took etiologic in terms of his Parkinson's disease? But regardless, this was a couple of years ago, and the majority of these individuals died natural causes, and 18 were accidental, 14 suicidal. So the implication has been in the press that any athlete who kills himself has chronic traumatic encephalopathy. And this is the impression that's been created. But it's not the case. Football players in other studies commit suicide at half the rate that baseball players do, and also less than the average population. And so we tried to find out some association with premorbid dementia, and the only risk factor we could come up with was a prior traumatic brain injury. But the problem is this. If one out of every 3 people over 80 years of age will develop Alzheimer's disease who have never played football. I have no question that at my age, and if I died, they would find in my brain neurofibrillary tangles and beta amyloid plaques, the so-called plaques, that are clearly diagnostic of Alzheimer's if there's too many of these. And I'm sure, if you looked at my brain, I have that. Frank Gifford, you remember Frank Gifford, the sportscaster? He died within the past year at age 84. And the last time he played football was 51 years ago. And he died from a heart attack. And they found beta amyloid plaque and neurofibrillary tangles in his brain. And the press nationally expounded on the fact that he had chronic traumatic encephalopathy. The disconnect, and this is terribly, terribly important to understand, many of the cases with neuropathological findings represent the normal aging process, the effect of drugs, or a variant of another degenerative disease. In other words, just because there's an abnormality in my brain in the pathology lab, you can't correlate that with the clinical picture. You get that? You get that right? So there's a major disconnect there. So, and this is where all of the confusion, because there are some who want to insist that if you have these particular abnormalities in your brain at death, you have this disease, and consequently, if you played football, that's where you got it. So I guess the point I'm trying to make that that there's a lot more to be learned about this, and in terms of participation in contact sports, my position is still very strong. That the General MacArthur said it best. He said, "On the fields of friendly strife are sown the seeds that on other days and on other fields will lead to victory." In other words, the lessons you learn in the soccer fields, the hockey field, the lacrosse field, the lessons you learn in participating in those sports are going to carry you on the rest of your life in terms of self-discipline, leadership, loyalty, friendship, camaraderie. So, traumatic brain injury and Alzheimer's, clearly, with serious head injuries, there is an increased incidence of Alzheimer's disease, an increased prevalence. A single or even multiple mild traumatic brain injury does not necessarily increase your risk of dementia or of Alzheimer's disease or of chronic traumatic encephalopathy. So what happens, all of the things that I talked about, inflammatory changes, lack of blood supply, and increased levels of this with severe or significant traumatic brain injury. So So what the new science of epigenetics, so the question I started out, the observation I made earlier was, okay, this is all great, but is there anything I can do to prevent neurodegeneration, to prevent dementia? Is there anything I can do to help myself not have these kind of problems that my mother does or my father does or my aunt or uncle does? And basically, there's a new science called epigenetics, which, as you know, we have in our chromosomes, we have genes. Genes are like a blueprint of a house. They do nothing until they're acted upon and told what to do by other factors. These other factors, epi means above, are above the genes, and these other factors tell the genes what to do, what proteins to make. So my father died at age 60 of a heart attack. And when I got to 60, I figured any day past 60 is going to be a bonus for me. And fortunately, I'm quite beyond that. And I have a very different lifestyle than my father. He had the typical diet that we've all had growing up. A lot of things that weren't always good for you. And Jeff, in our research, 70% of the diseases we get are environmental, meaning the choices we make in terms of our diet, in terms of our exercise, in terms of our environmental factors, and stress, how we control stress. So that if you look at a cell, you have the nucleus of the cell, you have the chromosomes, and on the chromosomes are the genes, 23, 25,000 genes. And when you eat a Mediterranean type diet with a little bit of red wine, not a lot, just enough, and you exercise and you drink clear water, don't smoke, don't drink, and control stress, what happens, these things create molecules in your body called transcription factors that instruct your genes what to do. Let me give you an example. Let's take this. Let's say you have a Big Mac from feedlot beef infused with hormones and antibiotics, fed corn from Iowa, not grass. Wash it down with a big bottle of phosphoric acid in terms of a soda that leaches calcium out of your bones. And then throw in some bad fats on French fries. The perfect American lunch. But what that does, it tells your genes to make inflammatory cytokines, just like we get a splinter under your finger. So not your finger, but your coronary arteries, your brain, your joints, all become inflamed. It's inflammation throughout your body that occurs. And the same with exercise and environment. If you polluted air, water, and soil, sometimes hard to avoid, particularly if you live in Flint, Michigan. And then controlling stress, which is one of the most important factors. If you look at the people in the world that live the longest, the most centenarians, those living over 100, where are some of the places that these people live? Excellent. Okinawa, Sardinia, and Costa Rica, and the Seventh-day Adventists in Loma Linda, California. Which is, why? What's there? Well, number one, they have generally a Mediterranean type of healthy diet. Number two, they work hard, which is their exercise, daily. Number three, clean air, clean water, clean soil. And number four, they're usually very spiritual, religious, and they have very strong family units. And if you have a strong family unit, What does that do for stress generally? Exactly. It reduces the stress. And we know excessive stress releases hormones, that cortisol in particular for one, that again causes osteoporosis, easy bruising, and brain inflammation. So a strong family unit is huge in terms of longevity. And so ways to protect your brain, we've mentioned these: exercise, diet, and stress control. You do have a choice. All of these have one thing in common. You can choose these. Nobody's forcing anything on you. You can choose it. So, and if there were a drug that could prevent heart attacks, strokes, and cancer, would anyone over 65 refuse this elixir? Well, it's exercise. They forgo exercise, which has all of these benefits. And I'm not talking about doing triathlons. Walking 10, 15, 20 minutes a day regularly is enough to really have a significant difference. And improves brain circulation and gradual, without exercise, there's gradual atrophy of the brain. The recent study at the University of Pittsburgh in Western Psych, they actually measured the volume of the brain in different people, and they found that those who don't exercise have atrophic brains. They lose, particularly in that part of the brain that observes memory. Those who walk 30 minutes a day actually have larger brains. That's true. And the Mediterranean diet I mentioned, there are many studies that show that it helps prevent Alzheimer's disease. It helps prevent it. So it reduces the risk of major chronic degenerative diseases. And these are the kind of things that you want to look for in your diet if you can. Omega-3 fish oil, legumes, nuts, and the benefits of it are huge. And fish also, there are thousands of papers that Jeff and I have written 2 books on now on fish and fish oil and the benefits of omega-3 fatty acids. Protective factors, moderate alcohol, that means no more than 2 glasses of wine a day for males, 1 for women. And using it, use it or lose it in terms of your brain. And social connections are terribly important. Again, feeling connected, it helps reduce stress, adequate sleep, and lots of omega-3 fatty acids. Sugar, bad stuff. The worst thing you can eat is sugar. It just, dark chocolate is okay if you don't eat a pound at a time. Dark chocolate and red wine, you can't get any better than that in moderation. But sugar, and we could speak for hours on that and what it does to the brain. So the brain-healthy diet, good fats, avocados, flaxseed oil, lean protein, complex carbohydrates, and then blueberries and the things that you can see there are all very, very positive. And avoid as much as you can medical x-rays. If your doctor wants to do a brain scan or wants to do a particular scan, you want to ask, what difference is it going to make in terms of doing this study or not? If your kid falls off of a swing, hits his head, gets taken to a hospital, and he's crying, what's the first thing they're going to scan? Going to do a CAT scan of the brain. How many chest x-rays is 1 CAT scan of the brain equivalent to? About 300. So it's like taking your kid in front of an x-ray machine and taking 200 to 300 chest x-rays of their head. So be cautious. I'm not saying don't get scans, but clearly you want to know if it's going to make a difference. And heavy toxins, we talked about lead during development, and also particularly in women who are pregnant. All of these things go straight into the fetus for the most part and can have very bad effects. Smoking, clearly related to dementia. 14% of all Alzheimer's cases worldwide may be associated with smoking. And stress is a brain killer. It literally, chronic stress kills the cells in the part of the brain called the hippocampus, which subserves memory. The first thing to go at Alzheimer's is memory. The first thing to go is your hippocampus, which is in the temporal portion of your brain. So, I think that this symposium is what Mr. Day has in mind in terms of taking, as I started earlier, Hippocrates said, the first function of a physician is to prevent disease. If that be impossible, to cure it. If that too be impossible, to relieve pain. And I think we do precious little in terms of preventing the kinds of things like concussions and sequelae of Alzheimer's that are going on.
Will you please join me in thanking Dr. Joseph Maroon? Now, we do need to mention that tonight's seminar is the first in a series that St. Barnabas will host these lectures on brain health. And I hope you feel like this was a good investment of your time tonight. Terribly educational, enlightening. Thank you. If you would like to be on the mailing list, if you would make sure you stop by one of the tables, we can get your name on the mailing list for postcards and for updates. If you are a runner, this is our final announcement. If you're a runner or a walker, we would ask that you consider taking part in the St. Barnabas Free Care 5K. The race is Saturday, August 6th at 9 a.m. This will raise money for the Free Care Fund. You do not have to be a fast runner. You can be a walker. I think my 90-year-old friend might actually be out there, given his health. Good luck keeping up with him. And they also have a 5K My Way, which is for seniors, and it's less than a mile. So this is something for everyone. We would invite you to take part. You'll find registration information, again, on your way out. Ladies and gentlemen, on behalf of St. Barnabas, thank you for being here. Good night. Be safe.